Welcome to aminacademy.com and questions how, why and what. Let us ask these questions and answer it. What are the challenges in pregnancy? What is cesarean? A pregnancy is a time of transformation for both the mother and the baby with significant physical and emotional changes. There are many discomforts that occur during pregnancy: morning sickness, headache, and backache, bladder and bowel changes, changes in hair and skin color, indigestion and heartburn, leg cramps and swelling, vaginal thrush and discharge are the few common complications facing during pregnancy. As a result, the aim of this study was to describe the difficulties in obtaining health information and the measures to overcome the discomfort during pregnancy. Research articles for this review the research articles for the preview. As a result, the aim of this study want to describe the difficulties in obtaining health information and the measure to overcome the discomfort during pregnancy. Research articles for this review were searched by using the keywords pregnancy, health issues, measure to overcome challenges. There are studies that look at the health problems that women face during the pregnancy were included in this article. We'll see pregnancy issues such as gestational diabetes, mellitus, hypertension, preeclampsia, cesarean birth, and postpartum weight retention are all more likely in overweight and obese women. More research into the link between nutritional advancement and the rising prevalence of GDM in the developing world is needed. Iron supplementation has been linked to glucose dysregulation and hypertension in mid pregnancy. Its effectiveness and potential risk should be carefully considered. As a result, legislators and health planners should remove barriers, promote self care, and improve the quality of life for pregnant women, ultimately improving their health. Now, let us discuss further about the challenges in pregnancy and what is cesarean. Pregnancy can involve a number of challenges, including a physical and mental health issues, as well as complications that affect the mother and baby. Physical health challenges: morning sickness, nausea, and vomiting that can be relieved with smaller meals, ginger, lemon, water, or wafers. Leg cramps, sudden sharp pains in the lower leg that can be relieved with the gentle stretching. Hemorrhoids, itchy, inflamed blood vessels around the anus that can be caused by constipation. Bleeding, heavy bleeding can be a sign of placemental complications, infections, or preterm labor. High blood pressure, a condition that can be dangerous for the mother. Gestational diabetes, a type of diabetes that can cause the baby to grow too large. Anemia, a condition where there are fewer than the normal number of healthy red blood cells. Mental health challenges, anxiety, and depressions. What are the complications? Shortly, ectopic pregnancy, when an embryo implants outside of the uterus. This more complication. Placenta previa, when the placenta partially or totally covers the cervix. Placental abruption, the complication of the placenta. Preterm labor, labor that occurs before the baby is fully developed. Stillbirth, the death of the baby is called stillbirth. What is cesarean? Here we talk about little about cesarean. Cesarean section or C-section or cesarean birth is the surgical delivering of a baby through a cut incision made in the birth parent's abdomen and uterus. Healthcare providers use it when they believe it is safer for the birth parents and baby or both. The cesarean section, also known as C-section, is surgical procedure to deliver a baby through incisions in the mother's abdomen and uterus. The mother is usually given regional anesthesia, spinal or epidural, to prevent pain. A horizontal or vertical incision is made in the lower abdomen and the underlying tissues are dissected to expose the uterus. An incision is then made in the uterus to remove the baby and placenta. When it's performed, a C-section is performed when it's considered safer for the mother, baby, or both. This could be because of problems that prevent a vaginal birth or if there are problems during labor. Recovery. A C-section usually requires a hospital stay for 2 or 3 days, and the mother is encouraged to drink fluids and walk to prevent constipation and deep vein thrombosis. The incision is monitored for sign of infection. Is cesarean good or not? A C-section, cesarean section is a surgical procedure that can be a safe way to deliver a baby in certain circumstances. However, it's usually best to have a vaginal birth if there are no medical reasons. When the C-section is recommended, breech baby. When the baby's feet or buttocks are the first part of to enter the birth canal. If it happened, that C-section needed. Multiple babies. When carrying twins, triplets, or more babies. Placenta previa. When the placenta covers the opening of the cervix. Prolapsed umbilical cord. When a loop of umbilical cord slips through the cervix. Health concerns. When the mother has a heart or brain conditions. Blockage. When there is a large fibroid pelvic fracture or the baby has hydrocephalus, then previous C-section. When the mother has had a previous C-section or other surgery on the uterus. Risk of a C-section. What are the risks? Increased bleeding, infection, bladder or bowel injury, reactions to medicines, blood clots, possibly injury to the baby, increased risk of respiratory distress for the baby, complication with future pregnancies, benefits of a C-sections, straightforward, quick, predictable, convenient, and regional anesthesia. Who is the father of Caesarean? The major turning point in the development of the Caesarean section appeared in 1882 when the German gynecologist Max Sanger, that is 1853 to 1903, suggested closing the uterine wound. Until this point, the wound was not sutured and so hemorrhage was a common cause of maternal death. So far, we discussed about what are the risk factor as well as how the cesarean has done. We have done. Please subscribe our YouTube channel.